I had extremely painful periods, down for the count, missing school at the onset of menarche. That means your first period. I was bleeding like 7+ days. It was horrible. I was put on the pill to cover up these painful, heavy periods. And it wasn't until actually an incidental MRI that it was discovered that I have endometriosis. So I have lots of protocols to stay out of pain, to avoid excision surgery if you don't need it. Because does everyone need excision surgery for endometriosis? Will everyone feel better if they have it? This has to be very individualized. You know your body. Sit through the lens of what's true for you. And I will say this, if you're gonna go for excision surgery, please consult at least. Welcome back to the Dr. Brighten Show. I'm your host, Dr. Jolene Brighten. I'm board certified in naturopathic endocrinology, a nutrition scientist, a certified sex counselor, and a certified menopause specialist. As always, I'm bringing you the latest, most up-to-date information to help you take charge of your health and take back your hormones. If you enjoy this kind of information, I invite you to visit my website, drbrighten.com, where I have a ton of free resources for you, including a newsletter that brings you some of the best information, including updates on this podcast. Now, as always, this information is brought to you cost-free, and because of that, I have to say thank you to my sponsors for making this possible. It's my aim to make sure that you can have all the tools and resources in your hands and that we end the gatekeeping. And in order to do that, I do have to get support for this podcast. Thank you so much for being here. I know your time is so valuable and so important, and it is not lost on me that you're sharing it with me right now. Don't forget to subscribe, leave a comment, or share this with a friend because it helps this podcast get out to everyone who needs it. All right, let's dive in. Hey there, welcome back to the Dr. Brighten Show. Today we're going to be talking about the preoperative plan for endometriosis excision surgery today. So if you don't know, hi, I'm Dr. Jolene Brighten. I'm a hormone expert and I have endometriosis and adenomyosis because why not? Just mix it all up. I try to laugh about it, try to have a good time with it, as much as you can have a good time with a chronic condition that leaves you fatigued and anxious and in pain. So I'm going to dive in today. Share this with anybody who has painful periods, has periods that last 8 days or more, who has ever been given hormonal birth control to manage their periods, to make the bleeding and the pain dampen down, anybody that could potentially have endometriosis. And also share this with people who know they have endometriosis. So I want to put all this information out there because when it comes to endometriosis, there's very little research funding, which means there's very little research happening, which means that all of us are left to figure it out on our own. I thankfully have a background in nutrition science. I am a hormone expert. I have expertise, but I'm going to say this. All the knowledge in the world does not mitigate the fears and the feelings, okay? I don't think that doctors share enough that when we have to go to surgery, we are freaking out sometimes, or we're scared, or we're asking a million questions, or we have anxiety. And I just want to normalize that for people. You're gonna have all the feels, and I have never talked to an endometriosis patient, nor anybody online has ever been yes, I was going to excision surgery. I didn't sweat it. It was no big deal. It is a big deal. It definitely is. So we're going to get in. I'm going to talk about a nutrition lifestyle supplements, primarily for preparing for excision surgery. Now, as I say this to you right now, I'm going to be really honest. I'm supposed to have surgery in 3 days, and I am still considering backing out because I don't want anyone in my body like that. And so maybe I will back out. We'll see. I'll stay tuned. I will let you know. Either way, I am definitely prepping my body. Okay, I want to get into all of this, but I first want to start with maybe you're I'm not familiar with your story. I can do a much longer episode on endometriosis. I did a 2-hour episode with Dr. Ram Cabrera, who is going to be doing my surgery and is one of the leading experts in endometriosis in the world. He flies all around the world doing surgeries, diagnosing women. I mean, he is just phenomenal. So we'll link to that. I want you to listen to that because there's a lot of insights that are shared in there. Now, for me, I had extremely painful periods, down for the count, missing school at the onset of menarche. That means your first period. Menarche equals first time you have a period. It was horrible. I was bleeding like 7+ days. I would go through a pad every hour. I had to hug a hot water bottle. I couldn't really take ibuprofen because it gives me horrible stomach pain. It's just not for me. I really struggled with my periods, and I was told this was normal. I was told this was normal by my mom, her friends, my aunts, my cousins. There's a theme here, right? Family history likely of endometriosis, but nobody getting diagnosed. I was also told it was normal by doctors, nurse practitioners. Literally anyone I saw was like, yeah, hi, welcome to womanhood. It sucks, doesn't it? It does when nobody is listening to you. And that, unfortunately, is how so many women go through their life and their experience with medicine, which is why this podcast and drbrighten.com and my books and everything I do exists. I made a joke online the other day of somebody saying, like, I will never forgive doctors and healthcare practitioners as a whole who dismiss women's symptoms. And I made this comment of like, I think a bigger person would forgive, but I'm not that person. I will take the rage that I feel of having been done dirty by medicine, and I will channel it into as much content, material, education as possible to ensure it never happens to any woman who enters into my atmosphere again. So I'll be holding on to my rage, and you will reap the benefits of it. Okay, so me, horrible, horrible periods. Go through that for about 3 years. Talk to another doctor. They're like, hey, here's the pill. It can take care of these periods and you'll have better skin. I did have good skin. I didn't have acne, but they were like, oh, you will never have acne. And like, here's the promise. No informed consent. No, like, hey, you could be at risk for strokes, depression, like any of the things that's in the package insert. This is really where Beyond the Pill was born out of, is that so many of us don't get the informed consent. Now, the ironic part of me writing Beyond the Pill is I talked ad nauseum, maybe, about how many women are put on the pill for painful periods, for irregular periods, for acne, for all these signs and symptoms that are actually underlying issues. Now, what's ironic is that 29 years later, I'm that person. I was put on the pill to cover up these painful, heavy periods. And it wasn't until I was diagnosed with secondary infertility, and it wasn't until actually an incidental MRI that it was discovered that I have endometriosis. So yeah, I didn't write that book expecting it was going to be about me, but lo and behold, I'm her. I'm that person. So if you don't know, roughly 60% of women who are given the pill are not taking it primarily for pregnancy prevention. They're taking it for symptom management. You have the right to use whatever you need to get out of pain, to function in your life. And if that's the pill, then you do you. I don't judge you. But I will judge your doctor if they're lazy and they don't do anything except pass you the pill and tell you, like, this is the best that we have, goodbye, because referrals are not happening that need to happen. So that was my story. Put on the pill, did it for a decade, came off because I was like not even sexually active. And I also was just like, it was the moment that I was sitting in med school and they were like, a woman can only get pregnant one day out of the month. And I was like, stop everything. What? Why am I taking this medication every single day that makes me feel awful? Because I was one of those people that had significant depression, repeat yeast infections, no libido. Like I'm in my 20s and I'm just like, don't look at me, don't touch me. I don't even care. I had side effects. So I was like, I'm getting off of this. Lo and behold, I get off of it, I lose my period, and when I finally get it back, it's raging. It's just like it was when I was a teen. I did a lot, nutrition, lifestyle-wise, to make my periods manageable, which was awesome for living and thriving, and I did have 2 kids. However, I also made it so that it was harder to detect endometriosis. So I fast forward, I'm told that my secondary infertility is because I'm old. Like they did all the blood work. Nobody checked me for endometriosis, which you cannot check via blood work. At least, I mean, there is a CA 125 that you can check, but that's not going to be definitive. The the best steps are transvaginal ultrasound, a gel MRI for deep endo mapping. And if things are seen there, then going for laparoscopy, excision surgery, if that's what you need. The only definitive way to really know is when you excise that surgery and you do the pathology, but you may not even need that. So anyhow, as it turns out, my third egg retrieval, because I go through IVF being told my eggs are old, except that I have like lots of eggs. My AMH is, my last one was 2.5 at 43. I'll be 44 in 2 months. That's amazing. My ovarian reserve is amazing. So this is all to say, it was not any of this stuff. I let people convince me I was old. Science and medicine, it's like what I've been taught is that at my age I would be old, no matter me having a baby at 40. Anyhow, I get Pronovo reaches out to me, an MRI company. They do full body MRIs. Incidentally, they find an endometrioma and adenomyosis. And then begins the journey of endometriosis. So I have lots of protocols to stay out of pain, to avoid excision surgery if you don't need it. Because does everyone need excision surgery for endometriosis? No. Will everyone feel better if they have it? No. This has to be very individualized. So if I didn't want to have another baby, I would not do this excision surgery because honestly, I don't have enough pain. I do have enough fatigue and other things going on to warrant it. It makes sense that on the ligaments of where the endometriosis is in my body, the kind of pain that I do have, but it's not debilitating. It's not enough to rush me to surgery by any means. This is more about I need to drop the inflammation in my body. I also have a fear because having an endometrioma, and I have bilateral endometriomas, that can increase your risk of ovarian cancer. So whereas the general population might be more than 1%, the woman with an endometrioma might be more like 2%, sometimes more. I do have a family history of an aunt who had ovarian cancer. So this is something that I'm I need to do everything to decrease my risk, which starts with nutrition and lifestyle, and excision surgery is an option in all of that. So I'm doing this podcast today. That was my quick version of everything going on, which didn't feel very quick, so I apologize. But I'm doing this podcast so that if you choose to go the route of excision surgery, because it may get you out of pain, because it may put a baby in your arms, which is not something that I take lightly, having had several miscarriages and failed embryo transfers. So I know sometimes I see people online that are just just take NAC and melatonin and try to have a baby. I take NAC and melatonin. Love it. It's great for endometriosis. Did not get me to a baby. Okay. So, what is true for you? That's what I want you to be asking yourself in this podcast, in every podcast episode I do, and every time you come across somebody on social media, on the internet, or you sit in a doctor's office. You know your body. Sit through the lens of what's true for you. And I will say this, if you're going to go for excision surgery, please consult at least 3 doctors, 3 surgeons first. You're running, I'm going to get some hate for this. I don't even care because I'm looking out for you and you're the only person I care about here. So if doctors want to come and they want to hate on me, they can just jog on. If your doctor is just a run-of-the-mill general OB-GYN, oh my God, great for pap smears, great for your physical exam, great for so many things, but not excision surgery. Don't mess around with this. Excision surgery can result in more adhesions and more pain if not done right. You want to have one and done if you can. You want to have a surgeon so good that they're going to get everything they can in there so you don't have to have surgery again in the future. So I can put a few of the doctors that I would recommend in my show notes that you consider consulting with if you have endometriosis. You've had excision surgery and you're this surgeon was the best. I sing their praise everywhere. Please share that. Drop it in. You can leave a comment. I read all of the comments on the podcast. So you can leave it there. You can leave it on YouTube. You can leave it on my social media, wherever you are consuming this. Please share that information because word of mouth is one of the best ways to find a surgeon. It really is. All right. So if you're considering going into excision surgery, you're going to screen your practitioners. I'm going to give you this other tip. If they don't want an MRI, like a deep endo mapping MRI, and they're not doing the Enzian score, I don't know that I would go with them. okay? Because you don't want your surgeon being surprised at what they find. There will always be some surprises when they get in there, okay? Because you cannot see everything on an MRI. But the MRI can give them a really good idea to help them give you a better informed consent. So telling you that, like, yeah, your lesions, they look like they might be infiltrating your bowels. If that's the case, we might have to do a bowel resection. This is what life will look like after surgery. This is what the procedure, this is how long it's going to take, how long you're going to be in the hospital. You should have all that information. And in fact, I'm going to put a link in the show notes. You can go to drbrighten.com/endometriosis and you can download my post-op plan that I put together, because honestly, I saw several doctors. I wasn't satisfied with their post-op. I was like, this is not detailed enough. So I put my own together, talking through all the ways to take care of yourself post-op. I think that I'll do a podcast episode about like what worked, what didn't work for me, and talk about that pretty candidly. And then, but I'm going to give you that as a resource. And in fact, everything that I talk about today, I'm going to just go ahead and put that in a PDF guide for you as well, for how to prep for this as well. So you can just download that and have that as well. And I'm just going to make a whole bundle for you. As I'm sitting here talking, I'm just like, I wish that instead of spending so much time on this from the patient perspective, having to do this, that like someone had just handed me all this stuff. So I'm going to do that. I'm going to do that for you. Okay, very first thing I want to talk about. So we're going to get into nutrition. Your nutrition absolutely matters. If a surgeon tells you it doesn't matter except for the bowel prep, just moonwalk right out that door. Just don't, because it absolutely matters. So when it comes to nutrition, here are the goals. So number one is we want to decrease inflammation. So we want to start dropping inflammation. Endometriosis is a systemic inflammatory condition. That means it's not just locked down in the lady parts. It is throughout your entire body, which is why you can have brain fog, fatigue, anxiety, mental health issues arising. It's not just from pain. It's that inflammation disrupts neurotransmitters in your brain. You can feel this in your joints. When I'm having an endo flare, like my poor little fingers can't even type. Like, I'm sure that if you have endometriosis, you can relate to some of what I'm saying here. So goal number one, we want to drop inflammation. Goal number two, we want to support immune function. You are going to be in a healing phase, right? A significant healing phase when you go through surgery. You don't want an infection, but you also don't want an immune system running amok. I have concern about how my body's going to act with these sutures, because when I had my second child and I had to have sutures, my immune system was really mad at that site for like a very long time. So you know, I also have a couple of autoimmune conditions. So my immune system, it's kind of like loves to misbehave. It's a little troublemaker. And just, you know, my personality is kind of a troublemaker. If you haven't caught on already in this podcast, calling out doctors. Okay. So the third goal is we want to improve gut health for recovery. So your gut is the seat of your immune system. So if we can effectively improve your gut health, we can improve your immune function and your inflammation as well. But your gut, we want to keep healthy because we want a nutrient-dense diet. But we also, as you know, I said this in Beyond the Pill, you're not what you eat, you're what you absorb. It's a very common saying in naturopathic medicine. That's where I heard it first. Functional medicine doctors also say it as well. Is if your gut's not healthy, you don't have adequate stomach acid, your little villi and your small intestine aren't ready to absorb things, like we can have issues with getting our nutrition up. Okay, so we want to eat an anti-inflammatory diet, and that feels kind of daunting, but I am not the type of person who likes to focus on what we take away. I'm the kind of person who wants to focus on what we bring in. So I want you to start bringing in more fish, cold water fish specifically. So, you know, this podcast, again, I want you to think about what's true for you. This is what I've started doing. This may not be right for you given certain medical conditions. Remember, I'm a doctor, not your doctor. So consult your doctor about what is best for you. Now, with fish, I have canned salmon, because if you follow me on social media, you know I'm like obsessed with salmon salad. I definitely can get in like food obsessed, where I just want to eat like the same thing all the time. Salmon salad, I'm like, that's a pass. You can eat that all the time. It's gonna be fine. So I've been eating a lot more salmon. I have sardines mackerel, anchovies, all of these are really great as well for omega-3 fatty acids, for selenium, for iodine. I have given myself permission just to eat salmon and not any of that other stuff because I'm like, look, surgery's gonna be hard enough and you hate that other food. Like, you just give yourself a little break here. So eating cold water fish, we want to start bringing that up, and that's going to be one way to start achieving more protein. We've got to front load the protein and the strength training, because after the surgery, you're not going to be able to lift weights from anywhere from 4 to 12 weeks, depending on how extensive it is. I'm in my 40s. In 4 weeks, I'm going to lose a lot of muscle. I'm kind of pissed about that right now because it's so hard to get it back. It's so hard at my age. And this is where I'm like, oh my God, it would have been so much better if I had this surgery in my 20s. I would recover so much faster, all these things. But like, judging myself on the past will not move me forward into the future. Okay, so fatty fish. Leafy greens. We want to be eating leafy greens. These are going to be great sources of minerals and antioxidants. So if you can bring in arugula, you want to have cooked broccoli, cauliflower. All of this is happening. You're starting this. So I should have said this first. I'm so sorry. 4 weeks before the surgery is ideally when you start all of this, because as you get closer to the surgery, within the day or two of the surgery, like cruciferous vegetables you want to have out because they could cause gas and bloating. And if you don't know, they're going to fill your abdomen with CO2 when they do this surgery, and you're going to be like bloated, and they're going to give you meds that are going to be they're going to bloated, and they're going to extend your abdomen, and then they're going to give you meds that are going to slow down your bowels. And like, there's just a lot going on already for those bowels. So leafy green vegetables, Swiss chard, rainbow chard. So arugula, I brought that up because that's a cruciferous vegetable, in with the broccoli and the cauliflower, Brussels sprouts. Looking at spinach. So spinach has iron. It's certainly not like the most bioavailable source of iron, but we want to start building up iron-rich foods. People will also say like, well, lentils aren't a great source of iron either, but you are getting iron from that, and it has fiber, and it has a bit of protein, and you do need carbohydrates as well. So when we look at those leafy green vegetables, berries. This is something I don't care if it's the dead of winter, try to get berries, even if they're frozen. So the fresher the produce, the more vitamin C. Vitamin C is an antioxidant. So as it gets cooked or cut, even frozen, the vitamin C can start to degrade. So fresh is definitely better. But if you got to go frozen, go frozen. For the vitamin C sake, you can also always add in like citrus fruits, which are great in the winter. But berries are going to be a source of vitamin C, antioxidants, polyphenols that are going to support your gut health, and fiber. So I've actually just been like eating handfuls of raspberries. Also, I've been eating dark cherries as well. That's helps support melatonin. They're anti-inflammatory. So starting to bring in more fruits and vegetables is really the takeaway here. But I want you to be really mindful that you're getting variety as well, because that helps the microbiome. Now, nuts and seeds, like chia seeds, I eat those most days of the week. My breakfast, if I'm having like a Greek yogurt, I will do chia seeds, fresh ground flax seeds. If I'm in the follicular phase when I'm seed cycling, I will bring in psyllium husk. So different fibers to give the microbiome some support and to keep the bowels moving. So walnuts can also be great, cashews. However, as you get closer to surgery, depending on what's going to happen for you, you want to follow the bowel protocol, which may say no nuts and seeds, like a week before surgery and even the weeks after surgery. So it all just depends on how extensive your surgery is. You got to individualize this to yourself. Okay, I mentioned protein intake. So there's the muscle mass loss that's going to happen. Not looking forward to that, but also, what are you made of? You're made of protein. So if you're trying to heal tissues, we have to be consuming more protein. Now, So before surgery, I'm trying to get closer to 2 grams per kilogram of body weight every day of protein. So if you've heard me in the perimenopause podcast, I talk about doing 30 grams of protein at every single meal as a minimum, is even more than that. And I'm supplementing. So I'm drinking protein powder drinks. There's yogurt drinks that don't have added sugar, but I'm not a fan of like how much sugar is actually in it. But I'm like, the goal here is to get more protein in the system. I always add collagen to my coffee, and I've been drinking Ensure. Oh, I don't like that. It's like first time I drank it, my gut was like, this is funky. We don't like this. But there has been research showing that if you consume things like Ensure, it doesn't have to be that brand. There's other enteral drinks that have lots of vitamins and minerals and nutrients in them. But consuming those like 2 to 3 times a day, I'm not doing that much. I'll just be honest. I'm doing like 1 or 2 a day. And then I've got like a yogurt drink that's like 20 grams of protein that I drink. And then another protein drink that's like 20 grams of protein that I'm doing. But I just want to say that there has been research showing that the drinks that are like Ensure, that they do have people who consume those before surgery, especially like the week before, do have better post-op outcomes. So while I'm not totally a fan of the way I would formulate it differently, I don't know if I have time to make a drink like that, but maybe I'll do that in some time. But like if I would formulate it differently, not like a really big fan. And they're just so sweet. It just really knocks me. I'm not like a sweet food kind of person. And then Organi is another company. They do they do like a vegan protein. They have drinks, and they believe they have about 20 grams of protein in them. I'm drinking that as well because it does have added nutrients to it. I'm just trying to get my nutrient stores just like over the tippy top. I'm not worried about any excess nutrients coming in and ending up with toxicity because this is a very short window of time. But I honestly, I will say that, if you're a vegan, you can go that route. If you're a vegetarian, you can go that route. If you are not, I do think animal protein is going to be much better quality. And what I mean by much better quality is the amino acid profile is there. You eat meat to rebuild your meat. I know that's probably cringe to say, but like if that makes sense to you, that like you should be wanting the same amino acid profile as muscle tissue if you're going to build muscle tissue. But I respect your diet, okay? So don't come for me in the comments if you're like, I can't believe you talk about eating meat. It was actually a conversation, side note here, at our dinner table last night with my kids, where my son was saying, like in his video game, he has pet ducks. So he's like, I'm never going to eat ducks again because like I feel this way about them. I'm like, okay, fair. And I was like, I feel that way about cows, honestly. Like I feel like I'm like, I love cows and I'm so torn. And also as somebody who's a vegetarian for 10 years and who's experimented in veganism, like my body needs meat. And that I have to respect that about myself. So I just share that because sometimes people are like, you're so heartless. And I'm like, no, I totally feel guilty sometimes eating a hamburger. And I'm just like, I just really am so grateful to this cow who gave its life so I could sustain my life. Anyhow, I'm taking it like that's a tangent. Okay. What I do want to say though is that endometriosis tends to have a buddy riding shotgun, which is iron deficiency anemia from the heavy periods. I don't have iron deficiency anemia. I had a full blood panel done. I checked all of my nutrients. I'm good. But still, it's a wise idea. You don't know what the blood loss is going to be to make sure that you're consuming iron-rich foods. We talked about lentils. We talked about spinach. Also red meat. Of course, like you're not going to beat that. It's going to be the best iron source. Can you eat organ meats? Oh my God. You're winning. You're winning there. So when you eat meat as well, it's also going to be bringing in other nutrients that help you build your red blood cells. And we want to be doing that. So namely, we want to be looking at iron, B12, B6, and folate. So I'm just jumping ahead of myself, but I'm taking my prenatal plus from Dr. Brighten Essentials on top of everything that I'm doing because one, hoping I get to a baby soon, but two, it is formulated to be very nutrient dense and it has an absorbable, non-constipating form of iron. And I really want to make sure that I don't end up anemic at any point because then you're really fatigued and you're really struggling to heal. Now, just going back to protein sources, we talked about the fish, we talked about meat. You can be eating tofu. I talked about all the beverages that I'm doing, but don't forget eggs. Eggs are awesome because eating the egg yolk specifically, so white's going to be protein. The egg yolk is going to be rich in vitamin A. Vitamin A is another one of those nutrients that we need for healing our tissue, but also helping our immune system. You're also going to find vitamin A in those dark leafy green vegetables. You're going to find it in carrots, sweet potatoes, so those carotenoids. It's not the active form of vitamin A like you're going to get in liver or egg or other animal proteins that have vitamin A, like the fat of chicken. That's why chicken soup helps as part of healing. Definitely going to be part of my post protocol. But with that vitamin A being in the carotenoids, your liver will convert it into the vitamin A that you need. So the beta carotene becomes that vitamin A. And it's a beautiful mechanism where your body will regulate that toxicity. Now, the foods I've already given you are great sources of fiber. So the lentils that we talked about, the leafy greens, the berries, but we also want to be looking at complex carbohydrates as well. So in an anti-inflammatory diet, sometimes people have you avoid oats, or they have you have only gluten-free oats or gluten-free organic oats. So the oats can be a really great source of fiber and really beneficial for gut health. But again, this is a what's true for you, what works for you, because it might not work for you. Now, let's not forget our friend avocados. Avocados are a great source of vitamin B6, which I told you is all about building up that blood. But it's also going to support your estrogen and progesterone, and it's a great source of fiber as well. And having those healthy fats come in is important. I am going to be dialing back dairy the day before my surgery happens. So I don't have to do a bowel prep, but I'm still going to mostly adhere to not a clear foods, but more of a liquid foods diet the day before my surgery. And the reason for that is that I just know my digestive tract and I know how finicky it can be. So I'm going to give my gut a bit of a rest for 3 days. That's going to be the day before surgery, the day of, and the day after of doing just, there's going to be liquids, and there's going to be smoothies, but then it'll also be like broths. I will cook like carrots and celery and just basically blend them up in the broth to drink that. So there's still some fibers there, but so that my gut doesn't have to work to try to digest it as much. Hydration is a must. Okay, for anything else, making the IV line easy to set, finding your veins, making them nice and plump and juicy, but you really want to hydrate. I drink about 3 liters a day. So I start with, in the morning, drinking electrolytes. I prefer Element. It's what I like. It's palatable. I like the profile of the minerals that are in there. So that's what I start my day with, is drinking that. I am also bringing on coconut water. Coconut water is another great source of electrolytes. For me, little TMI, but it helps move my bowels. So I've already got it stocked for after the surgery, because I wanted to say, anybody who's ever had abdominal surgery or an egg retrieval or anything happening in that area knows constipation makes it all worse. You ever had a baby? Constipation makes it all worse. So we want to keep those bowels moving. So that's going to be part of the hydration piece as well. Bringing in additional anti-inflammatory, so like turmeric and ginger can also be really beneficial. So, buying pre-made shots can be really expensive. I don't know. I just am always somebody who's like, if I can make it myself, I'm just do it. So I am blending up turmeric, ginger, lemon juice. Yes, it's going to degrade. That vitamin C is going to degrade because it's going to sit, but I'm not going to be up for this once I've gone through surgery. So, and then I add water to it and I just blend that whole thing up. And I usually throw in like oranges or green apple, something to sweeten it up because it's potent. It was a lot. And then I strain it and I put it in bottles for storage, and I'll be drinking that. I am drinking that, and then I'll be adding more of that post-op as well into the routine, because that's going to help my gut. It's also going to help with modulating inflammation as well. We don't want to kill all the inflammation. We don't want to squash it all. We need inflammation. It's an important part of the healing process. But like I said, I don't want my inflammation getting so crazy that I feel absolutely awful. Okay, lifestyle-wise, I was not prepared for how I would feel going into this. It's been kind of a shock where I'm like crying about like, oh God, I don't want scars on my belly, crying like Endometriosis_surgeon on Instagram. Great account for seeing surgeries, what's going to go on. I can't watch them right now. Like I've recommended them, I've shared them. I can't watch them because the thought of someone inside my body with the instruments and it's giving me the heebie-jeebies. Like, I did not expect that, especially because like they're gonna have to like be around my ligaments and my nerves. Oh, it makes me like so squeamish to like think about it being done on me. And I say this as somebody who's like dissected cadavers. I've dissected a lot of things. I used to run a biology lab when I was getting my master's. Like, oh my God, I've dissected a lot of stuff, and never ever have I had an issue. But oh my God, now that I'm facing this is being done to me, is like making me squeamish. So, it's the countdown. I go into the hospital in 2 days to be admitted. So 4 days total before my surgery that all of this really started hitting me. And I did not expect this. And I've not heard anyone talk about this. This is why I'm still like chickening out. I'm like, I don't know if I really want to do this. I really wish that I had somebody in the mental health arena who understood endometriosis. I know these people exist. But yeah, I just haven't put one on my team, and I regret that right now. So, it is something, I just think it's important to have someone to talk to. I also think it's important to start working on stress if you haven't already. So again, remember, we're trying to start this 4 weeks before, but even if it's 4 days before, like meditate, do yoga, like deep breathing, like whatever it takes, binaural beats for you to start bringing down your stress levels. Stress results in bad outcomes, which only makes you feel more stressed. But also a positive mindset results in positive outcomes. So I've actually recorded some affirmations of things, me talking to myself, being like, your body's beautiful, it's strong, it is capable of healing, it is designed to recover, and, just like things along those lines. It actually doesn't start with it's beautiful, but it's actually because I was like thinking about the scars that I'm like, I need to put that in there. I need to say that. So yes, whatever you can do to start bringing down your stress. Surgery is stressful in itself. And so start something now that you can continue on. And maybe it's just you record your own little affirmations, or you listen to an affirmation app. You take that to the hospital with you, you put in your earbuds and you listen to that. By the way, charge all of your stuff before you go to the hospital and bring all of your chargers with you. I have like these bricks that you can put like USB, you can put all kinds of things in. I can probably put them on Amazon. Yeah, I could put them on Amazon. I'll put a link in the show notes of like, here's these things that I'm taking to the hospital just to like make it easier to be in there and make sure that all of my stuff is charged. Sleep. This is something that we would tell somebody like in any major life event that is coming, right? Like if it's childbirth, if it's running a marathon, whatever it is, get your sleep now. So I'm kind of perturbed that I have to go. My surgery is at 5 a.m. They're like, you have to come to the hospital the night before. I'm like, great. So I'm not going to sleep. And then they're like, oh yeah, and you might have to stay the extra night. I'm like, great. So I'm not going to sleep again. Like, and they're like, no, it's going to be great. We're going to make you comfortable. I'm like, do you have fluorescent lights? Yes. Okay. So if your big lights are on, I'm not going to sleep. I'm going to be irritated. I'm not going to be a nice person if you're waking me up at like 2 or 3 o'clock in the morning to do stuff. Like I apologize in advance to my team because yeah, but also like hospitals are foreign and they're cold and they're like icky sometimes, the vibe of a hospital, And so this is why it's so important to sleep now. And in case you're just like wondering, like, how are you a doctor and you're saying that about a hospital? I literally had home births because I do not like to be in hospitals. I don't like If I'm the patient, I don't want to be in the hospital. Like, come to my house and let's do everything, guys. No, you can't do that with a surgery. So anyhow, 7 to 9 hours now. Start getting it now. 7 is too little for most women. This research of 7 to 9 hours is actually based on men. In reality, your minimum is more like 8, and you're probably going to do better at 9 or 10, especially as you prep for surgery. So if it means taking melatonin at night, which by the way, I take melatonin, not for sleep, but actually for endometriosis because it's an antioxidant. It's been shown to be very beneficial. It's also great for egg quality. So with that, if you need to take melatonin, take that. I'm also taking my adrenal calm supplement, which has L-theanine in it, which is like such a great amino acid for like calming your mind. It has phosphatidylserine for dropping cortisol, passion flower, which helps GABA stimulation in the brain. That's how we stay asleep at night. So I'm also taking that. So because I'm like, I just have to ensure I get the best sleep despite having 2 kids. Exercise-wise, there's a lot of people who will say, you need to dial back before you go into surgery. And I've seen people say like 1 to 2 weeks before surgery, it should just be like really gentle, really relaxing. I am lifting weights. I will hit it through, like, this is my routine. Okay, I'm not starting a new routine. 3 times a week, I will hit that this week. I am walking. I am doing all the things to support my muscle mass, to support my health, but also because I will go crazy. Like every time I have an egg retrieval, my doctor, he like sends me these funny little memes about what a baby I am because I'm just like, I can't lay here anymore. I need to get up. I will stay tuned. I'll tell you how post-op goes for me. But I am lifting weights. Your doctor may tell you 1 to 2 weeks before surgery, avoid strenuous activity or really heavy weights. If that's what they're saying, it's because that's what in the individualized information that you need to be receiving, okay? I'm not like powerlifting. I'm not maxing out, but I am still just challenging my muscles and reminding them that I need them. Don't go away. I'm talking to them. I'm talking to them every day. Okay, the week before surgery, you got to stop alcohol. You got to stop anything that could thin your blood. So alcohol has to go. Better if you do it a month before, because your liver is going to have to also process all of the anesthesia, all the meds going on. And in addition, with alcohol, it can raise estrogen levels, which is problematic for endometriosis. I hate to be the one to tell you, but like just alcohol is not great for our hormones and not great for our bodies. If you're a smoker, please stop, like immediately. Like never. And that goes for vaping as well. And if it's cannabis and it's combustible, that means it's smoke. Stop that. Stop. That is too much free radical damage happening to your cells. Okay. Your doctor's probably going to tell you at least 4 weeks before you need to quit smoking. I will just tell you that, like, as you're listening to this podcast in 2025, you know smoking's not good for your health. We don't need to finger wag you. Okay. But before surgery, it's got to stop. Okay, so let's talk about supplements now. So supplements, we want to be getting inflammation down. We want to be building our nutrient stores. We want to be bringing on things that help us have healthy red blood cells. We want to be making sure that we've got everything our body needs to heal and it's taking care of our immune system. Vitamin D3 is something that is a must. In my opinion, your doctor might have a different opinion. It might be different for your body. We always want to check blood values. If they're below 50, we probably want to bring on a supplement. Some doctors let you go as low as 20. That's really low. Okay, so ideally we want to be above 50. I am taking, so Dr. Brighten Essentials has a vitamin D3. It's coupled with K2. It needs to be coupled with K2 so that calcium ends up in your bones and not your blood. Vitamin D3 can be so positive for the immune system. I am currently taking 4,000 IUs of it a day. That's what's right for me. Yours might be 2,000 IUs a day. It might be 5,000 IUs a day. Your doctor should run these labs and really guide you in that. Now, I've been taking omega-3 fatty acids, but I have stopped because I'm within the week of going into my surgery. I was only taking 3,000 milligrams. It could potentially be a blood thinner. As somebody who's been on higher doses, and had my blood tested for my clotting time, it's not been an issue. However, this is true for me. I do have a gene mutation for a clotting disorder. And so this is going to look different for me than what it's going to look like for someone who doesn't have that. But all of us should not take omega-3 fatty acids that week before the surgery. I'll be back on them. Probably, I'm thinking 5 to 7 days post-surgery because I'm going to be on blood thinners. I'm going to be on a low molecular weight heparin. It's called enoxaparina here. It's Lovenox in the United States. They're not sponsors. This is just what I have to do because I'm deathly afraid of a clot. So I'll be wearing compression stockings. I got compression socks. They'll put them on me during surgery. I'll wear them afterwards. I'll wear them probably for a week. I'm going to get up and walk every hour. If I can just get up for 5 minutes. I've got my Apple Watch, which will remind me. It's seriously so annoying sometimes though. Last night I sat down to eat dinner and it was like, you need to stand. And I'm like, I was literally in the kitchen. What do you mean I need to stand? Anyhow, I digress. So going back to the supplements. So we talked about omega-3 fatty acids. These are anti-inflammatory. They can be really, really helpful for endometriosis. They're just really helpful overall in terms of your mental health and your immune system health. Now, I talked about eating vitamin C rich foods. I'm also supplementing with vitamin C. I'm taking 1,000 milligrams 3 times a day of vitamin C. I want to make sure that I've got everything to rebuild that collagen. And afterwards, I may up my vitamin C. So I have magnesium citrate ready to go in case I do have some constipation. I will take that. Vitamin C can also loosen up the stools as well. And so I am considering increasing that dose. We'll just see how everything goes. Zinc is another one that I'm bringing in. So again, I'm taking my Prenatal Plus that has zinc in it, that has all of the B vitamins and the iron to rebuild my red blood cells. It has just a ton of nutrients like vitamin E, which you want vitamin E when you're taking vitamin C because they work together as antioxidants. So little nerd moment. Vitamin C is water soluble. It sits in the aqueous layer of the cell. Vitamin E is in the lipid bilayer. So you've literally got this little lipid bilayer around your cell. And when a free radical hits it, vitamin E donates an electron. Vitamin C comes in and says, here you go. You can have mine. I'll take care of you, vitamin E. So that helps with oxidative stress. And when your immune system gets activated, we have an increase in oxidative stress because part of how the immune system works is creating these free radicals to battle bacteria, viruses, things that we don't want living in the wrong parts of our body or in the wrong amounts of our body. So in addition to the prenatal, I'm taking 15 milligrams of zinc. My prenatal has copper in it, which helps balance zinc and copper. This is going to be a short period of time, so I'm not going to take it for a long period of time. If I was, I would be really mindful of the copper balance with that. Now, vitamin A is also in my Prenatal Plus, and that's a combination of the beta carotene and active vitamin A because not everybody has the genes to effectively activate that vitamin A. We keep it at a lower dose because in pregnancy, you don't want high dose vitamin A. I am bringing on additional vitamin A as a supplement, and I'm going to be aiming for about 5,000 IUs of vitamin A in addition to what's in the prenatal, and that's only going to be for about 4 weeks, maybe 6 weeks total from the start. So I started this a couple weeks ago, and then I will continue it a couple weeks post-op just to support my immune system and that tissue healing. Depending on how I feel, how things are going, I might continue it longer. Now, I told you I'm drinking collagen in my coffee every day. Coffee's going to go. Post-op, coffee's got to go just because it can be irritating. So I'm going to be keeping up the collagen. The collagen is about 20 grams a day that I'm doing. And so on top of the protein intake, I also bring in the collagen, and that's to support tissue healing. I am taking probiotics currently, and I will continue those post-op as well. So I'm taking our women's probiotic along with Saccharomyces boulardii. So the women's probiotic, that has a combination of lactobacillus, which we need for all parts of our body. The lactobacillus content of the gut is pretty reflective of the lactobacillus content of your vagina. There is maybe this is news to you, and it might sound icky, but your gut and your vagina, they share bacteria, and there can actually be a migration across the perineum. And so we need to make sure our gut is healthy if we want to keep our vagina healthy. And when antibiotics come into play, they start knocking down good guys. The probiotic also has spore-based organisms in it, and that helps keep, it's basically, they're like bouncers in the club. So if anyone's getting rowdy, it helps keep everybody in check. And it also has antioxidants and prebiotics. The antioxidants are specifically ones that have been studied for urinary tract health. I don't want a UTI, so I'm keeping that on lock. And then the Saccharomyces boulardii, that's a yeast, and it's been shown in the research to raise secretory IgA. Secretory IgA is a specific immunoglobulin that grabs on to stuff in your gut that ought not be there. And so it's going to help my gut health. It's also going to help my immune system. Now, I talked a little bit about what I'm taking for sleep. The other thing I'm taking is magnesium glycinate, and I'm taking 300 milligrams every night. I always get headaches after I go under, and it doesn't matter how much water I drink. It doesn't matter if I eat, it just doesn't matter, but it has mattered with the magnesium. It's dulled the headaches that I get anytime I go into general anesthesia, and it's also helping me stay calm. I think I would freak out a lot more if I didn't have magnesium aiding me. And magnesium, along with the cruciferous vegetables, along with the amino acids, the B vitamins we talked about, all of those support liver detoxification, which we want to be at its best for our hormones always, but also because, again, there's going to be medications that your liver has to process. So we want to give it the best leg up for that. I am also taking glutathione, and I'm taking a liquid glutathione. And the reason for that is that I already said I was taking NAC as well. So I guess I should say that. Okay, so I take NAC about 600 milligrams, which is a precursor to glutathione. It also helps with liver detoxification. It's been shown to be beneficial for those with endometriosis. And I'm taking glutathione, which is a really, really potent antioxidant. I want to make sure I'm supporting my liver health. But again, I want to make sure that the oxidative stress doesn't get the best of me. Okay, now before your surgery, I told you no omega-3 fatty acids. Vitamin E is something else you don't want to have in high amounts. Like I said, I'm just taking what's in my prenatal. That's not a high amount. Ginkgo biloba is another thing that if you have that in any of your supplements, that can cause blood thinning depending on the dose. And if you're supplementing with garlic, that can also do it. So if you're taking any supplements that are meant to help with cardiovascular health, make sure there's no blood thinners in it, and go over your list of supplements with your doctor to make sure that they're okay with everything that you're taking, because there may be a nutrient interaction that you don't know about. You can also Google this. It does exist online where there's drug nutrient interaction calculators out there. You can input it and you can look at it, and that can sometimes be helpful, because sometimes your doctor might say, I don't know. I wasn't trained in nutrition. I don't know anything about supplements because I was never trained in that. Okay, there's more supplements that I'm taking than just this that are not specific to this procedure. So I'm taking CoQ10, L-carnitine. I'm taking alpha-lipoic acid. I have adrenal support. I have my mix of things that keeps and has kept my autoimmunity antibodies in check, my endometriosis symptoms in check, and they're part of a fertility protocol. That's all just to say that your protocol may not look exactly like mine. And I hope that you are able to pick and choose from this what is best for you and take that with your provider and to have a conversation with them. Now, I alluded to before that if you need to have bowel prep, make sure that you talk to your doctor about that. What will the bowel prep look like for you? Talk to them about medications that you are on right now. So if you're on things like aspirin, right? We talked about blood thinners, stop that. 7 to 10 days is usually what's recommended before going into surgery. But again, talk to your doctor about that, because if you've got a whole list of clotting factors, they may be like, let's switch things up and let's do some things differently. Instead of these medications you're on, let's swap these out with other things. Okay, so that has covered the nutrition, lifestyle, supplements. I want to come back to the emotional preparation and just harp on that for a minute if I can. If you're someone who's prone to anxiety, like I'm prone to anxiety, then the unknown is the freakiest, scariest thing. It's worse than a monster under the bed kind of situation. Make a list of questions. Ask them and ask them and ask them. I don't even care if you annoy your doctor. I'm pretty sure I'm annoying my doctor right now, but if things are not crystal clear for me and I exactly know what to anticipate or what to prep or what's going to happen. I asked for a timeline from my doctor. You say surgeries is 5 a.m. Talk me through what that's going to look like. What can I expect in the morning? When can I expect to be out of surgery? Knowing that these things are ish, right? It's an hour-ish. When can my family come and see me? When can I be discharged? When can I eat? When everything, right? Go through the timeline. Ask all of the questions. Ask things like, am I going to have sutures or am I going to have staples? Sutures are definitely more preferred because staples are not fun to get out afterwards. But ask your doctor these things. Where do you expect to make these incisions? How many incisions are you expecting that you're going to have to make? What is the risk that I have to have an incision that's similar to a C-section? What is my individual risk for developing a blood clot? I went to a cardiologist. It's required when you're in your 40s, but really I think everybody should consult with a cardiologist if it's accessible to know what their risk factor is for a clot, to get an EKG and make sure that there's no heart arrhythmias, there's no issues there. Get it worked up and make sure that you're comfortable going into this. So I want to give you permission to be annoying. There should be somebody at your doctor's office to answer your questions, and you should be able to ask as many questions as you like. Make sure that you arrange for childcare, someone to take care of household tasks. This is something that I think we really need doulas or midwives, people to come in and help people post hysterectomy, post endometrial excision, post really fibroid removal, anything that's happening in your pelvis, that can lay you down for a while. I say you want to get up and you want to move, but you also need to rest. And so make sure that you have somebody that's going to come in and help you. If you can just Uber Eats stuff. If you can meal prep ahead of time, have everything you're going to need, make sure you do that. All the laundry needs to be done ahead of time. If there's toys and towels and things on the floor, let them be. You got a month, you let them be. If you go and push them around with a broom, I'm not judging you. Take care of yourself and make sure you have an opportunity to rest. Now, a tool I think could be really helpful in this that I'm going to employ is journaling. Writing down your thoughts, your feelings, your emotions, getting those out before surgery. When I wake up from surgery, I might do this too, and after surgery as well. But journaling is a really healthy, easy way to process your emotions. And it can always be helpful to go back and read how you were feeling in the past. But maybe for you, it's going to look like prayer. Maybe it's going to look like meditation. But whatever it is that helps you process your emotions, please make sure you hold space for that. Okay, so I just want to take a moment to summarize a timeline for you. So 4 weeks before surgery, start optimizing sleep, start improving your nutrition, start your supplements. 2 to 3 weeks before surgery, make sure you're on the anti-inflammatory diet. Okay, so 4 weeks, you start optimizing things. By 3 to 2 weeks, counting down to the surgery, make sure you're on that anti-inflammatory diet and ensure you're being adequately hydrated. This will matter weeks in advance. If you haven't started supplements yet, this is the time to definitely get the supplements on board and to begin those. 2 weeks before your surgery, make sure that you are finalizing the post-op with your doctor, that you're getting all of your questions answered. This is going to help mitigate anxiety and stress before you're going into it. And if you haven't started stress reduction practices, tending to your emotional health, start it now. A week before surgery, you start looking at the supplements you're going to cut out to make sure that there's nothing that's going to interfere with medications or have any kind of blood thinning impact. You may also want to start dialing back your exercise at this point. The day before surgery, you're going to do the bowel prep if that's part of your protocol. And that might look like consuming clear liquids only. So I hope that timeline is helpful, and I hope this entire podcast episode has been helpful in you being able to put together a game plan heading into excision surgery. You can certainly use this if you are looking at going into any kind of surgery and really tailor it towards that. This isn't just endometriosis excision specific. There's lots of other surgeries that this would apply to. So as always, please like, share, subscribe, leave me a comment. You guide the conversations here, and I always want to be delivering the most helpful information to you. So let me know what that is, and we will make sure that it comes out in a future episode. I hope you enjoyed this episode. If this is the kind of content you're into, then I highly recommend checking out this.